All right, ready to dive into the world of health and well-being. Get this. Our source material today is IELTS Prep Guides.
IELTS Prep Guides.
Yep, IELTS.
Huh.
It might sound a little out there,
Okay.
but it's super interesting to see what these language learning resources have to say about health. Who knew, right?
It is pretty cool to see how they break down these complex health ideas into like bite-sized pieces.
Right.
It reminds us that healthy living doesn't have to be so complicated, you know?
Exactly.
It boils down to a few key principles.
So true.
Yeah.
So let's jump right in. Why is a healthy lifestyle so important?
Yeah, like what's the big deal?
We hear it all the time, but what's the real reason? One of the IELTS experts, Ethan, really emphasizes that a healthy lifestyle can help us prevent those long-term chronic diseases. Plus, it improves our overall quality of life,
Makes sense.
and it gives us more energy.
Feeling good is the goal.
Exactly.
Not just living longer.
It's about adding life to our years, not just years to our life, right?
Right. Totally agree.
And get this in one of the IELTS example answers.
Okay.
Ethan breaks down this whole complex idea of a healthy lifestyle into simple terms, like really simple.
Nice.
It's like, hey, maintaining a balanced diet, super important,
Huh.
and get moving. Incorporate regular exercise.
Yeah, it's not rocket science.
Exactly. It's like he's saying, you can totally do this. I love that.
Very approachable.
Speaking of diet,
Yes.
I know you've been looking into different approaches,
And I have.
especially intermittent fasting.
Yes. So interesting.
Now, how does intermittent fasting fit in with this idea of balanced meals that Ethan's talking about?
Well, that's a great question. You see, the IELTS material focuses on the broad idea of a balanced meal, which means having a variety of healthy foods. But intermittent fasting is more about when you eat. So it's kind of a different approach to the same goal.
Oh, I see.
Yeah.
Yeah.
Reaching that balanced nutrition.
Interesting.
There's actually some research suggesting that intermittent fasting can help with weight management and improving metabolic health. But it's definitely something to talk to your doctor about, especially if you have any other health conditions.
Makes sense.
Yeah, it's not one size fits all,
Right. Okay, so we hear this term well-being all the time. What does it really mean?
Well, it's more than just being physically healthy, that's for sure.
Right, so is it mental too?
Totally. Well-being includes our physical health,
Okay.
our mental health,
Yeah.
and even our social health.
Oh, wow.
It's about feeling good in every single part of our lives.
Yeah, makes sense.
Ethan actually touches on this in the IELTS material.
Does he?
Yeah. He really emphasizes feeling happy and content as a major part of overall well-being.
It's like that saying, right? Healthy body, healthy mind.
Exactly.
They go together.
They are super connected.
So often we think of them as separate, but they're not.
Oh, not at all.
Does the IELTS material talk about that connection?
There's this great example in there.
Okay.
It highlights how exercise can actually impact both our physical and mental well-being.
Interesting.
So regular physical activity not only makes our heart and muscles stronger, right?
Right.
But it also plays a huge role in reducing stress
Wow.
and boosting our mood.
Makes you feel good.
Right.
I remember the IELTS material talking about endorphins.
Oh, yes. Endorphins.
And I know that was in your notes too.
Absolutely.
How do they work?
Okay, so endorphins are super fascinating. They're these natural chemicals in our brains,
Okay.
and they act like neurotransmitters, which basically means they send signals between nerve cells.
Wow.
So get this, endorphins actually interact with receptors in our brains that reduce pain.
Really?
Yeah, like opioids do,
Oh, wow.
but without the bad side effects, of course. And here's the best part.
What's that?
They trigger a positive feeling in our body, like that runner's high.
It's like a reward system.
Exactly.
Our brain is rewarding us for taking care of ourselves.
Exactly.
The IELTS material also mentions the downsides of a sedentary lifestyle. What does that mean exactly?
So a sedentary lifestyle is one where you don't get a lot of physical activity. And it can be really bad for us, both physically and mentally.
Huh.
Our bodies are literally designed to move.
Yeah.
But when we spend too much time sitting or lying down, our muscles get weaker,
Oh, wow.
our metabolism slows down, and we're at a higher risk for chronic diseases like heart disease,
Oh, no.
type 2 diabetes, even some types of cancer.
So it's more than just about looking good.
So much more.
It's about being healthy
It's about feeling good.
and preventing those problems in the future.
Absolutely. Investing in our long-term health and well-being.
Exactly.
And the good news is You don't have to go to the gym for hours every day.
That's a relief.
The IELTS material really stresses that even moderate activity can make a huge difference.
Like what?
Brisk walking.
Oh, okay.
Dancing, gardening.
I like that.
Just moving your body.
So find something you enjoy.
Yes.
Make it a part of your life.
Make it a habit.
Exactly. All right, so we know that a healthy lifestyle is super important.
For sure.
But what about when we need extra help? Like, what role does the healthcare system play?
That's a really important question. A good healthcare system is like a safety net.
Okay.
Making sure we can get quality care when we really need it.
Yeah.
Whether that's for preventing something or treating an illness.
Now, Ethan mentions in the IELTS material that a good healthcare system needs to be accessible, affordable, and efficient.
Absolutely.
And he gives an example of how a good system helps everyone, no matter their background.
Right.
So what does that actually look like? Like, how do we make healthcare fair for everyone?
That's a complex question.
I bet.
There are a lot of different models out there. The IELTS material talks about universal healthcare, a system where everybody has access to healthcare services.
No matter what.
Exactly, no matter if they can pay or not, because healthcare is a human right.
Wow, I like that.
Not just a privilege for the wealthy or for people with specific insurance.
So that sounds ideal, but how do you actually achieve that?
Well, different countries have different ways of doing it.
Oh, really?
Yeah, some systems are run by the government.
Yep.
Others have a mix of public and private providers. Some have a single-payer model where the government pays for everything. And others have a multi-payer system where the government, insurance companies, and even individuals chip in.
Wow, that's a lot.
It can get complicated, for sure.
So how does the IELTS material compare these different systems?
They use a really interesting example. It compares a system with free healthcare to one that relies mostly on private insurance. And it shows that free healthcare might mean waiting longer for some procedures, while private care can be really expensive, which can cause problems for people and families.
Oh, makes sense.
It's all about finding that balance between making healthcare affordable and making sure it's actually good quality.
So it's not just about having healthcare. It's about having good healthcare that people can actually get.
Absolutely. And that's where health insurance comes in.
Okay.
The IELTS material explains that health insurance helps cover those costs.
Kind of like car insurance, but for your health.
Exactly. But there's a ton of different types of health insurance plans out there.
Oh, I bet.
Each with different levels of coverage, premiums, and deductibles. It can get pretty confusing.
Healthcare systems are complicated.
They are.
But it sounds like the main takeaway is that we need a system that works for everybody.
Yeah.
It needs to be fair and make sure everyone can get the healthcare they need.
I totally agree. It's not just a personal responsibility. It's a societal one.
It's something we need to work on together.
Exactly. To make sure everyone is healthy and well.
Okay, so we've talked about balanced meals.
Yes.
And regular exercise. What does that actually look like day to day?
Great question. Let's get into the details.
What advice does Ethan give in the IELTS material?
Well, his advice is actually pretty simple and straightforward.
Okay.
He says, eat lots of fruits and veggies.
I can do that.
Whole grains are your friends. Minimize processed foods, sugary drinks, and unhealthy fats.
Okay.
And stay hydrated by drinking plenty of water.
Basically, eat real food and drink water.
Pretty much. And what I really liked is how Ethan stresses the importance of balance.
Does he?
Yeah, it's not about depriving yourself. It's about making healthy choices most of the time.
I like that.
Yeah, it's about sustainability, not punishment.
So what about exercise?
All right, so the IELTS material uses this example of consistency.
Consistency.
Yeah, you don't have to go all out every single day.
Oh, thank goodness.
It's more about finding activities you actually enjoy and then doing them regularly.
Right, make it a part of your life.
Exactly. Even a couple of times a week can make a big difference.
So finding that sweet spot.
Yes.
Where it feels good.
And sustainable.
Not a chore.
Right. And it doesn't have to be complicated or expensive either.
That's good.
Just take the stairs instead of the elevator.
Okay.
Walk or bike to work. Dance around your living room.
I love that.
It all counts.
So we talked about processed foods earlier.
They did.
What are they? And why are they bad?
So processed foods are basically foods that have been changed from their natural state.
Okay.
Through cooking, canning, freezing, packaging, or adding preservatives.
Got it.
And while some processed foods can be good,
Oh, like what?
like frozen fruits and veggies
Okay.
or canned beans,
Right.
a lot of them are full of added sugars,
Horrible.
unhealthy fats, sodium, and all kinds of artificial ingredients.
So it's about reading those labels,
Exactly.
making informed choices.
And choosing foods that nourish your body.
What about whole grains?
Oh, whole grains are amazing.
Why?
They're packed with fiber, vitamins, minerals, antioxidants.
Well,
The whole grain kernel is there, you know, the bran, the germ, the endosperm. Unlike refined grains, which have been processed and lost some of that good stuff.
oh, I see.
Think brown rice, quinoa, oats, whole wheat bread.
Those are good.
Right. They give you energy, help with digestion, and can even help balance your blood sugar.
So switching to whole grains.
It's a simple change that can make a big difference.
Exactly. And it's all about making those gradual changes, right?
Absolutely. You don't have to change everything overnight.
Yeah, that's overwhelming.
Just start with 1 or 2 healthy swaps
Little by little.
and see how you feel.
Okay, so I have to mention this idiom.
Oh, which one?
You are what you eat.
I love that one.
It's such a good reminder that our food choices directly affect how we feel.
Exactly. Food is fuel for our bodies and minds.
Right. So if we're putting in good fuel,
Then we're going to run better.
exactly. And speaking of running better, our bodies need regular maintenance, just like a car. I like that analogy. So choosing healthy foods, being active, managing our stress, getting enough sleep.
Those are all part of the maintenance plan.
Exactly. This has been a great conversation.
It has.
I can't believe how much we're learning from IELTS prep materials.
Right. Who knew?
It's amazing how health is connected to so many different parts of our lives.
It really is.
And it seems like the main thing here is that building a healthy lifestyle doesn't have to be super hard.
Not at all.
It's about making small changes consistent.
And finding joy in the process.
That's a good point. It should be enjoyable.
It should. It's about being good to your body and mind.
And creating a lifestyle that supports your health and happiness.
Absolutely. All right, are you ready to keep going?
Oh yeah, I'm ready for more.
Great. Let's do it.
All right, so we've talked about a lot,
We have.
from the basics of a healthy lifestyle
Uh-huh.
to how complicated healthcare systems can be.
It's a lot.
But I want to bring it back to you for a second.
Okay.
What stood out to you so far?
It's wild to me that these IELTS materials,
I know, right?
which are made for learning a language,
Yeah.
make us think so much about health.
It's like they're sparking all these new ideas.
They really are.
And you're right. We need to connect this back to our own lives.
Absolutely.
Like, how does this all fit into our own health journeys?
For me, what really resonates is this whole holistic approach. It's not just about what you eat and how much you exercise.
It's bigger than that.
So much bigger. It's about mental well-being, managing stress, even the kind of healthcare system we have.
It's like all these pieces of a puzzle.
It is.
And they all fit together to create a healthier and happier life.
Exactly.
Speaking of puzzles, you mentioned in your notes that you haven't been sleeping well lately.
Oh, yeah.
And the IELTS material really emphasizes how important sleep is.
It's crucial.
But I've also heard that sleeping too much can be bad.
You've heard, right?
Is there a point where it's too much of a good thing?
That's a really good question. And a lot of people don't realize that oversleeping can actually be a problem.
Like, seriously?
Yeah. We know that not getting enough sleep is bad. But studies have shown that sleeping more than 9 or 10 hours a night can increase your risk for things like heart problems,
Oh, wow.
diabetes, and even problems with your thinking and memory.
So it's about finding that balance again.
It always comes back to balance.
So shooting for that 7-8 hours of sleep seems like the sweet spot.
It really does.
Now, Ethan, in the IELTS material, talks a lot about managing stress.
Stress is a big one.
And it feels like stress is everywhere these days.
You can't avoid it.
So what are some practical tips for managing stress?
You know, I really like Ethan's suggestion of mindfulness.
Mindfulness.
Yeah, it's about being present in the moment,
Okay.
paying attention to your thoughts and feelings without judging them.
So like hitting the pause button on all the noise in our heads.
Exactly. Finding that calm amidst the chaos.
That sounds amazing,
It is.
but also a little intimidating.
Yeah, I get it.
Like, where do you even start?
You can start small. You don't need hours of meditation or anything.
Okay.
Even a few minutes a day can make a difference.
Like what?
One of my favorite techniques is mindful breathing.
How do you do that?
Just take a few moments to focus on your breath.
Okay.
Notice the feeling of each inhale and exhale.
That's it?
It's that simple. You can do it while you're walking, eating, even waiting in line.
So finding little moments of peace throughout the day.
That's the idea.
Now, we're social creatures, right?
We are.
But sometimes it feels like modern life makes it hard to connect with people.
It can be tough.
The IELTS material doesn't really talk about this.
Right.
But it feels important to me.
It's huge EE. Social connection is so important for our well-being.
How so?
Strong social bonds give us a sense of belonging, a sense of purpose.
Okay.
And they help us cope with stress. It's like having a built-in support system.
It goes back to that holistic approach we were talking about.
It does. We need to nurture those connections just like we nurture our physical and mental health.
So it's about those relationships that make us feel happy and connected.
Exactly.
Now, going back to healthcare systems, you mentioned you were interested in learning more about how different countries handle healthcare.
I am. It's fascinating to me how healthcare systems reflect a country's values.
It's like looking into a country's soul.
It is.
Seeing what they prioritize.
The IELTS material talks about universal healthcare.
Yeah.
But there's so much more to it.
Like what?
Every country has its own unique approach.
Right.
Shaped by history, culture, and economics.
It's all connected.
It really is.
And the IELTS material compares different systems, talking about the pros and cons of each.
Like free healthcare versus private insurance.
Right.
Free healthcare might mean waiting longer for some procedures, while private care can be super expensive.
It's tough to find that perfect balance.
It is, but it's a challenge that a lot of countries are trying to tackle.
Are they?
Yeah. Some are focusing on preventative care.
Okay.
Investing in things that help people stay healthy in the first place.
So they don't get sick later.
Right.
Yeah.
That way, it costs less in the long run.
Makes sense.
Others are using technology to make healthcare more accessible, especially in rural areas.
Telehealth.
Exactly. It's constantly evolving.
So they're always trying to find the best solution.
They are.
I like that.
It's exciting.
Ethan in the IELTS material really emphasized preventative care.
It's so important.
It's like that saying, an ounce of prevention is worth a pound of cure.
I love that saying.
But what does it actually mean in our daily lives?
Well, preventative care is all about taking steps to protect your health before you get sick.
Okay.
It's about reducing your risk of developing diseases and staying healthy for as long as possible.
Like going to the doctor for checkups even when you feel fine.
Exactly. That's a great example from the IELTS material. Regular checkups let your doctor monitor your health, catch any potential problems early, and give you personalized advice.
It's like having a health expert on your team.
It is. They're there to help you navigate the healthcare system and make good decisions.
So it's about being proactive.
Exactly, instead of just reacting when something goes wrong.
And you mentioned that preventative care also involves lifestyle choices.
Oh, absolutely. A lot of what we've been talking about falls under that umbrella.
So eating healthy, staying active, managing stress, getting enough sleep.
It's all connected. It's about investing in your future health.
And preventing those chronic diseases.
They've got it.
It's like we're building a foundation for a healthier life.
Brick by brick.
With every healthy choice we make.
I like that.
Now, one thing we haven't talked about much is mental well-being.
Mental health is so important.
It's as important as physical health.
They go hand in hand.
We touched on the connection earlier.
Yeah.
But I'd love to dive a little deeper.
Let's do it.
What are some practical tips for taking care of our mental health? Especially in a world that can feel so overwhelming.
You know, the IELTS material focuses on holistic well-being. And I think a big part of that is self-care.
Self-care?
Yeah. It's about taking care of your mental and emotional needs. It's not selfish. It's essential.
What are some good self-care practices?
It's different for everyone.
Right.
Some people like to spend time in nature.
Okay.
Others find peace in creative activities like painting or writing.
I like that.
It's about doing things that bring you joy.
Makes sense.
Spend time with loved ones, practice gratitude, anything that fills your cup.
So it's about honoring your individual needs.
Exactly.
What makes one person happy might not work for someone else.
Right. It's about finding what lights you up.
What makes you feel whole.
Yes. And remember, self-care isn't a luxury, it's a necessity.
That's a good point.
When you take care of your mental health, you can handle life's challenges better.
Right.
Your relationships improve. You have more energy to pursue your passions.
This deep dive has been amazing.
It really has.
We've gone way beyond what you'd normally find in an IELTS prep session.
That's the best part.
It's like we took this one topic and explored it from every angle.
Discovering all these hidden gems along the way.
Exactly.
Yeah.
It just shows the power of curiosity.
And that you can learn from the most unexpected places.
You ready to keep going?
Let's wrap this up.
This deep dive has been incredible. We've covered so much. From IELTS prep no less.
Who would have thought?
I know, right? We've explored healthy lifestyles, different healthcare systems, and how to prioritize our well-being. It's amazing how these seemingly simple ideas can lead to such deep insights.
It shows you how everything's connected, you know?
Yeah, and it really highlights how much control we have over our own health and happiness. We're not just along for the ride, we're in the driver's seat.
Exactly. We have the power to make choices that support our well-being.
So as we wrap up, let's bring it back to you, the listener. What are some key takeaways you can actually use in your life?
I think the biggest takeaway is to remember that holistic approach we talked about.
That whole picture view of health.
Right. Health isn't just about not being sick.
It's about thriving.
In every aspect of your life.
Yeah.
Physically, mentally, socially.
So it's about making choices that support our minds and bodies.
Exactly. And remember, those choices affect more than just us. They impact our communities, even the planet.
It's all connected, right? And we talked about how small changes can lead to big results.
Little by little.
You don't have to change everything overnight.
Just start with 1 or 2 healthy habits.
Like swapping sugary drinks for water.
Or adding more fruits and veggies to your plate.
Or taking a few minutes for mindful breathing.
Those little steps add up over time.
It's about progress, not perfection.
Be kind to yourself.
Celebrate the wins. Learn from the setbacks.
You are worth investing in.
That's so important to remember. You deserve to feel good.
To be happy.
To live a vibrant, joyful life.
And you don't have to do it alone.
Reach out for support. Connect with people who care about you.
Build a community that lifts you up.
And never stop learning. Stay curious. Explore new ideas.
Even IELTS prep guides.
You never know where you'll find inspiration.
That's the beauty of it.
So keep exploring.
Keep learning.
And keep investing in yourself and your health.
That's the best investment you can make.
Thanks for joining us on this deep dive. Until next time.
See you then.